Foundational Mobility Fitness Assessment. The developmental milestones of an infant reflect fundamental movements of life. The movements that we developed, not learned, as an infant are critical to maintain as an adult. This test sequence is a reflection of these essential movements. Difficulty with any of these movements indicates areas in need of improvement in order to improve overall health and fitness. The fundamental movements are breathing, spinal extension, rolling over, crawling and reaching, squatting, walking. Begin by quietly standing, arms resting at your side, taking some nice deep breaths in and out. As you're breathing, appreciate how easy it is for you to take that deep breath in and exhale. Now, gently grasp your thighs with your hands. Not too tight, just a gentle grasp. Relax your shoulders. Now, take those deep breaths in and out again. Is it just as easy to take those deep breaths in, or is it a little bit harder? If it's a little bit harder, this indicates that we need to work on your breathing muscles as well as your core. Next, we move into spinal extension. Rest your hands gently on your hips and lean backwards. Does this feel easy to do? Is it uncomfortable? Do you think you could go back further, but you can't? Gently rotate to the left and rotate to the right. Are those pretty easy too? Next, we proceed into the reaching movement by assessing shoulder function. Can you raise both your hands over your head from your side with the back of your hands touching each other overhead? Now, can you bring the back of your hands to touch between your shoulder blades? And then the other one. The next developmental movement we assess is squatting. Using the split squat, also called the lunge, are you able to get your rear knee down to the floor? As you notice, this also has a bit of a resemblance to the ability to walk. Next is the full body squat. Can you get down to at least 90 degrees with ease? Can you get even further? Most toddlers can do perfect squats. Now we challenge balance and walking ability through an exaggerated arm swing that somewhat mimics walking. Is this easy to do? Are you able to maintain your balance? Are you able to maintain your balance on both sides? Is this causing shoulder pain or lower back discomfort? Next, we proceed to the floor-based movements, which obviously is where infants actually begin. And we begin on the back because that's where infants usually begin. And we're going to lift our hips up to do a pelvic bridge. This reflects the strength that's necessary for an infant to roll over. Now, do you need your hands on the floor to help lift up your hips, or can you put your hands behind your head and lift up your hips? Now, can you lift one foot and then the other foot without your hips dropping to the floor? You might need some assistance by putting your hands on the floor to provide some stability. Next, we proceed to the crawling and spinal extension movements. Putting your hands and your knees and feet in the position as demonstrated, keeping your back as straight as possible. Can you lift the opposite hand and leg off the floor? Can you proceed to do the like manner of movements and mimic crawling, both forward and backwards? Do you have any discomfort in your low back? Is it hard to keep your hips stable? Now we proceed to spinal extension. Can you push your chest off the floor while keeping your hips close to the floor, also called being grounded? Can you rotate your body to look to the right and then to the left? This concludes the Foundational Mobility Fitness Assessment. The score. The ease of movement, minimal pain and full range of motion, and the number of movements able to do with ease reflects your overall fitness. Those areas where you struggle are areas that can be worked and improved on through a variety of fitness routines.